Proposed healthcare funding cuts, including Congress's plan to slash Medicaid, could put already struggling rural hospitals in Kentucky at risk of closure. I'm Piper Hansen, a business and economic development reporter here at the Lexington Herald-Leader. Here's what those funding cuts could mean for the bluegrass state. If proposed cuts outlined in President Donald Trump's budget bill go through, then Kentucky stands to lose up to $28 billion it uses to ensure those seeking medical care and prop up healthcare providers that employ thousands. The loss of funding means 35 rural hospitals across our state could be at risk of closing. A report by the Shep Center for Health Service Research at the University of North Carolina identified the country's top 10% of hospitals receiving payments from Medicaid and those that finished the past 3 years with negative margins. In total, their report estimates there are 338 hospitals across the country that could close if Medicaid spending gets cut. If Congress cuts Medicaid, the report says that for every 10 hospitals that might close, at least one would be in Kentucky. Our state has the highest number of potential facility closures across the country. Hospitals use Medicaid dollars to cover standard payments for services they provide. When hospitals rely on revenue streams from patients using Medicaid, which is a kind of insurance given from a joint federal and state program to cover the cost of healthcare for people, especially with limited income, and that source of payment goes away, that's when a facility may start to experience financial strain. Because of rising labor and supply costs, regulatory complexities, and a reliance on Medicaid and other insurance reimbursements for care, hospitals already make small profits and run with little to no difference between revenue and expenses. Rural hospitals, nonprofit hospitals, and those with a large number of patients covered by Medicaid are more vulnerable to closure. Nearly 1.5 million Kentuckians are enrolled in Medicaid, almost 30% of the state's population. The Kentucky Center for Economic Policy estimates 346,000 Kentuckians would lose coverage if Medicaid spending cuts are passed into law. And that kind of pressure on hospital operations could mean those providers implement cost-saving practices like reducing services. As a result, patients' access could be reduced, and they may face longer wait times or be forced to drive even farther to get care. Regardless of how Kentuckians are insured, potential impact to rural hospitals would make getting healthcare even more difficult for everyone. You can read more of this story over at Kentucky.com. Thanks for watching.